So today we have the topic of constipation. It is a very common presentation and it is often misdiagnosed. So we have to follow a diagnostic approach, due to which, with the help of a diagnostic model, we can easily diagnose some serious problems related to constipation. First of all, we have to start with probable diagnosis. So what can be the probable diagnosis? So most commonly, the constipation is functional. What is functional constipation? It is actually idiopathic, which has no known cause and no structural or systemic diseases present there. It is termed as functional constipation. It has two types. It has two under the heading of primary constipation. Primary constipation actually have the slow transit, and the time of passing stool is uh, longer. Then we have the dysynergic constipation. It is a paradoxical contraction rather than relaxation of the sphincter during the defecation. Then we have the simple constipation, which is usually due to the lifestyle, lack of fiber, and increased processed foods, lack of vegetables and fruits. So this type of constipation, which is due to lifestyle, like sedentary lifestyle and lack of exercise, lack of sleep. So these and bad bowel habits, often ignoring the call of defecation. So these are all come under the simple constipation. Then we have serious disorders, which should not be missed. They include intrinsic and extrinsic malignancy. Intrinsic malignancy, in which the cancer and the mass is present inside the intestine, and in extrinsic malignancy, there is a mass outside the intestine and outside the bowel, which is pressing on the bowel and causing obstruction and constipation. Then we have Hirschsprung disease. It is a very important and very serious disorder which should not be misdiagnosed in children. Actually, it can cause megacolon, and the symptoms are present from birth. And if there is a history of delayed meconium passage, so it is a Hirschsprung disease. Then we have neurological causes, often seen in the patients who have paraplegia, who have multiple sclerosis, the cerebral palsy patients, and in diabetic patients who have autonomic neuropathy. The patients can complain of constipation, often associated with fecal impaction. So, what are the alarming symptoms for serious disorders? For example, the recent constipation, recent constipation in a patient of more than 40 years of age. There is rectal bleeding, and there's a family history of cancer, and fecal occult blood is positive. So these are the alarming symptoms for serious disorders. Then we have pitfalls. So impacted pieces is a very common disorder, often ignored and often difficult, often unable to diagnose. Then we have local anal lesions like anal fissure and hemorrhoids, fistula. These are the lesions which can cause constipation, or the constipation can also cause local anal lesions and vice versa. Then we have depressive illness. Any depressive illness can cause constipation. Then we have the electrolyte disturbance, for example, hypokalemia. If a patient is on diuretic and insulin, he can experience hypokalemia. Then we have the drugs and purgative use, diverticular disease in elderly patients, hypercalcemia, and hyperparathyroidism. These are all the pitfalls, um, and the disorders that often get ignored and often misdiagnosed. Then we have this our seven masquerades list, in which the depression can be one of them, which can cause constipation. Then we have diabetes, which can cause constipation and diarrhea, alternate bowel habits due to autonomic neuropathy. Then we have drugs, certain drugs, and then we have hypothyroidism, hyperparathyroidism, and spinal dysfunction if severe. And then we have the patient is trying to tell me, for example, if the patient has a disorder of anorexia, these patients often complain of constipation. Then we have the schizophrenia and any misuse, drug misuse. They can all complain of constipation. There is a term of dyschezia. What is dyschezia? Dyschezia is actually a lazy bowel. When the patients are constantly ignoring the repeated calls of defecation, then the bowel or rectum become unresponsive, which is called as lazy bowel or dyschezia. Moving forward, we have causes of constipation in age wise. First of all, we have constipation in children. What is considered as constipation in children if they have less than three bowel motions per week and more than one episode of fecal incontinence in 1 week. There are large stools palpable in rectum, and there is withholding behavior. For example, reluctant to pass a stool, reluctant behavior, for example, crying, irritation, and stiffness and rigid posture. Then we have painful defecation. Painful defecation can be a sign of constipation in children. Any two or more of the above in previous 2 months is termed as constipation in children. What are the red flags we have to look for in the complaint of constipation if the patient are children? If there is a child, what can be the red flags? And these are blood in stools, perianal disease, delayed meconium history, delayed history of delayed meconium. Then we have urinary symptoms like bedwetting history, neurological findings in legs, medications for behavioral issues. If a child has behavioral issues and he is using certain medications, certain psychological medicines to correct his behavior, these can cause constipation in children. There is fever, weight loss, delayed growth, and vomiting. These are the red flags which are important in children to look for. Then we have two or three certain disorders, for example, Hirschsprung disorder. If there is delayed passing first meconium history and then the patient has subsequent constipation, we will suspect Hirschsprung disorder. On X-ray or enema, there would be distended colon, which is full of feces. But it will lead to narrow rectum. This is the diagnostic finding on X-ray, and on biopsy there would be absent ganglionic cells. In Versus, we have acquired megacolon, which is present in older children and adults. It is usually due to bad habit and can be caused by chronic laxative abuse, Chagas disease, hypothyroidism, and bad bowel habits. On X-ray, there would also be colon full of feces like Hirschsprung disorder, but the rectum but there would be no narrow segment of rectum. On the other hand, on in Hirschsprung disorder, there would be narrow rectum. Then we have anal fissure. Anal fissure is a very common complaint in children. They pass the hard stool with pain, and there is bleeding on defecation. And due to severe pain, the patient is there is the contraction of anal sphincter. And it is difficult to pass the stool. And when the stool is passed, it is hard and causes bleeding on defecation. Then we have constipation in elderly. Constipation in elderly can be a very alarming sign of colorectal cancer. Fecal infection can be there, and Parkinson's disorder and other brain disorders in elderly patients. In fecal infection, the signs of fecal infection can be malaise, anorexia, nausea, confusion, and abdominal discomfort in elderly patients. In colorectal carcinoma, what can be the risk factors? They are ulcerative colitis, familial adenomatous polyposis syndrome, decreased dietary fibers, and age for more than 50 years. These are the risk factors. What can be the symptoms? Blood and mucus, along with the stool, along with constipation, recent bowel habit change, and alternating constipation with a spurious diarrhea. Actually, what is a spurious diarrhea? There is constipation due to mass and colorectal cancer. And when the constipation, and when there is a hard stool present for some more time, it is followed by diarrhea, which is called as spurious diarrhea. And then he has constipation and a hard stool, then he has a spurious diarrhea due to um, present hard stool for some time. Then we have the tenesmus. Tenesmus is actually a feeling of frequent urge to defecate due to unsatisfaction. Actually, the mass is present in the rectum, and it is often misinterpreted as feces. The patient is feeling the mass; it is taking the mass as feces, and he constantly goes to defecate, but there is but the patient feels unsatisfaction, and due to which there is frequent urge to defecate, which is called as tenesmus. According to sites, we have some different symptoms of colorectal cancer. For example, if the mass is present in right colon, there would be anemia, dyspepsia, palpable mass. If the mass is present in left colon, the complaints would be pain, and there would be obstruction, partial obstruction can be there, and altered bowel habits. If the mass is in sigmoid colon, there can be obstruction, altered bowel habits, and rectal bleeding can also be there. If the mass is present in rectum, there would be mass felt on rectal examination. Rectal bleeding would be there, and tenesmus would also be there. Okay, when we are going to refer the patient to a specialist, if there is a recent change in bowel habit without an obvious cause, and the chronic symptoms which do not respond to simple measures, so we have to refer such patients to specialists. So that's it for constipation. Hope you find it easy to understand. And I try to summarize the constipation and how are we going to approach the patient with constipation. Thank you.